This is Dr. Hornfeld. This is a not so smooth insertion and extraction of a Malyugan ring. It's a 2.4 millimeter clear corneal incision. This is an IFIS case. Um, the second instrument that I use is, in this case, it's going to be a Kugelin hook, but you can use a Sinsky, or sometimes I use Dr. McCool has something called a small ball chopper. Or you can use MST, comes out with an instrument. I believe it's designed by Dr. Gimbel. Looks like an upside down mushroom. That's a pretty smooth way to use this. So I inject viscoelastic under the iris to bring the iris off the anterior capsule. Here comes my Kugelin, and what I like to do is engage, of course, the distal eyelet first, and I do like to engage the right and left eyelets as I insert. So here I had the right eyelid was a little under the iris, so I rotated the right eyelid into position, and the left eyelid disappears under the iris. So I engage the proximal. So now I have distal, proximal, and right eyelid engaged, and the left eyelid is under the iris. I haven't noticed it, by the way, not yet. So I got everything in place. I feel pretty good about myself. I'm ready to, what I like to do here is I do like to inject a little more viscoelastic just to flatten the surface of the anterior capsule to make the capsulorhexis process easier. So here I am, I'm about to do that, and I realize, hey, wait a minute, where's my left eyelid? So the process, the technique here is you get, I have my Kugelin ring, I engage the smooth side of the Malyugan ring and kind of gently make my way under the iris and tickle it back into the proper position. And problem solved. So, and then of course here I'm going to inject a little more viscoelastic just to flatten the surface anterior capsule again. Now this is, like I said, it's an IFIS case. What happens is with IFIS, the iris will not come out of the wound, not with the Malyugan ring in place. But what happens sometimes is the iris does come up and get in the way, interferes with the instruments that you're bringing in and out of the clear corneal incision, which can you can damage the iris that way. So if that happens, what I like to do is I just simply put in some more viscoelastic. I go through the side port and track over the eyelet that's under the incision, and just give myself some space, and that solves the problem. So here I'm completing the capsulorhexis, and I'm going to skip forward to the removal process. So here we're done with the case. There's still viscoelastic in the eye. You take the Kugelin, you remove the distal eyelet first. Didn't work on my first try. It's you know, the Kugelin is not really the best instrument here. The Kugelin, sometimes you want to be careful not to damage the edge of the iris. You want to be meticulous in engaging right between the eyelid and the iris. So now you go in with it's the same inserter used to extract. What I like to do is bring that hook right to the opening, so you don't have to go a long way when you have everything in position. Now I'm going to disengage the proximal eyelid from the iris, and out comes the hook. You want to engage both loops of the eyelid. That's very important. And here I'm going to miss it, and I missed the entire loop. I'm in completely the wrong position here, so I have to re-aim. I gotta come back. There you go. Re-grasp with the Kugelin, and now grab both You want to make sure you're under both rings of that eyelet. And you don't have to bring the Malyugan ring all the way into the inserter. At this position, you can just extract the entire